Mr. Speaker, since this government took office, the number of Nova Scotians on the Need a Family Doctor list has almost doubled, rising by 66,000 people. The number of people on the wait list in the Central Zone has more than tripled to over 61,000 people. When we ask about why these numbers are so high, the Premier accuses us of being negative. Meanwhile, the government is about to allow another 6 doctors to close their practice, adding 8,000 people to the list. Mr. Speaker, if money is no object in healthcare, then why won't the Premier do what it takes to keep these practices open and these 8,000 people attached to a family health team?
The Honourable Premier.
Well, thank you, Mr. Speaker. And look, the reality is the leader of the NDP is extremely negative. It's not an accusation, Mr. Speaker. It's a sheer fact.
Order, please. Order, please. The Premier has the floor. The Honourable Premier.
I've heard the leader of the NDP refer to the NSHA as awful. I've heard her refer to projects as rotten. It's extremely negative, Mr. Speaker. But what I would say to those Nova Scotians who are on the Need a Family Practice list, and there are a number of them, Mr. Speaker, we're concerned about it. Being on that list does not mean there's no access to care. The world is changing, Mr. Speaker. We're innovating ways to make sure that they have access to care. Everyone on that list has access to virtual care. 57,000 Nova Scotians have signed up for that. And there are other ways to access care as well, Mr.
The Honourable
Speaker.
Leader of the New Democratic Party on her first supplementary.
At the risk of being negative, Mr. Speaker, I will go on. Last week, the Vice President of Medicine at Nova Scotia Health, Nicole Boutlier, sent a letter to doctors that said, and I quote, "Recent media has been dominated with family doctors announcing retirements and lack of support to stay in practice from Nova Scotia Health and health system partners. This is not the message our teams have been working very hard to send, and we want to change this narrative immediately to reflect that commitment." I think the Premier is trying to do the same in this chamber. And we have a great suggestion for how to change the narrative. Support doctors in the way they are asking so that their practices can remain open. Mr. Speaker, will the Premier commit to helping these clinics open and to not leaving 8,000 patients unattached to family care?
The Honourable Premier.
Mr. Speaker, the simple reality is the health leadership team under the guidance of the minister is working very hard to support physicians. And I know that the email that went out, which is a periodic email that goes every week, the opposition clinged on a certain phrase in there. But I will tell you this, Mr. Speaker, at the healthcare summit this week, there was a number of physicians around the table, and they thanked Dr. Boutlier for sending that message, saying, "We are here to support you. We are here to support those doctors, and we will continue to be here to support them."
The Honourable Leader of the New Democratic Party on her final supplementary.
Third time's the charm. Let's get a question period and an answer period. Mr. Speaker, Dr. Rewicka from the Spryfield Family Clinic that will have to close said, and I quote, "I'm retiring with a very heavy heart because I feel so sorry and guilty even for my patients. I've been their family doctor for over 30 years. They don't know what they're going to do, and some of the patients are so complex that really, truly, I do not believe they'll be able to manage their health." And I'll table that. After pleading for help from Nova Scotia Health, the government said they would not help this clinic remain open unless 2 doctors added to their 4,000 patient roster. So instead, we have 4,000 people without a doctor at all. Mr. Speaker, if the Premier wants to support doctors in their retirement, surely this means letting them retire with a clear conscience. So I will ask a third time, will he commit to keeping these clinics open?
Mr. Speaker, what I would say and what I'll continue to say, and can ask as many different spins or as many negative connotations as you want on it, this government supports our healthcare professionals. We showed that yesterday with a very significant investment in incentive. We are showing that to doctors. We will support them. We will work with them. Our number one concern, Mr. Speaker, the number one thing we're concerned about, access to care for patients. We will invest in those mechanisms that get access to care for patients.
The Honourable Leader at the official opposition.